Hello, Connecticut, and welcome to the Paid Leave Podcast. The title basically says it all. I'm Nancy Barrow, and I will be delving into this new state program and how it can help you and your family. This podcast will give you information you should know about Connecticut paid leave and maybe just a little bit more. Connecticut paid leave brings peace of mind to your home, family, and workplace. Welcome to the Paid Leave Podcast. August is Breastfeeding Awareness Month, and today we focus a little bit more on the mom's side of things. Breastfeeding has proven to have health benefits for both the moms and the babies in high-income and low-income settings. Yet less than 50% of babies worldwide are breastfed, according to the World Health Organization recommendations. And for decades, the commercial milk formula industry has used marketing strategies, and they generate revenues of about $55 billion each year. On December 29th, 2022, President Biden signed the Consolidated Appropriations Act 2023 into law. That law includes the Pump for Nursing Mothers Act. That's the PUMP Act, which extends to more nursing employees the rights to receive break time to pump and a private place to pump at work. And the Fair Labor Standards Act also requires employers to provide reasonable break time for an employee to express breast milk for their nursing child, at least for 1 year after the child's birth. Connecticut paid leave gives up to 12 weeks of income replacement to parents so they can bond with their new baby. And part of that bonding, of course, is breastfeeding. Joining me today are Monica Belia, who is a nutrition consultant with the Connecticut Department of Public Health. Her expertise is in early childhood health and education systems and infant and young child feeding and nutrition. She is the past chair of the Connecticut Breastfeeding Coalition and a steering committee member of the Middletown Racial Justice Coalition. Also joining is Taylor Smith. Before becoming an interdisciplinary doula, her roles all involve taking care of others. She has strong interests in science, nutrition, herbal remedies, and lactation. She is a certified lactation counselor and is extremely passionate about helping women through their breastfeeding and pregnancy journey. She's currently a participant in Paving the Way, which I find so cool, Diversity in Lactation. It's a mentorship program that aims to increase BIPOC numbers in lactation by guiding women of color to obtain their International Board Certified Lactation Consultant credentials. And she will be sitting for the exam this fall. As the founder of the owner of Nourish Our Seeds, Taylor's goals is to provide urban communities with culturally competent, thorough, and dignified perinatal care. And Taylor currently serves as the co-chair of the Connecticut Breastfeeding Coalition and strives to improve breastfeeding outcomes for families throughout the state.
Thanks, Nancy.
Yeah, it's so nice to have you both here. Thank you so much. Taylor, can you tell me what an interdisciplinary doula is?
Yes, so that speaks more to my training, to be very honest. I went through a 14-month training, and that differs from most doula trainings. Usually to receive your doula certification, you do about 3 days of training and then some clinical work that you have to kind of do on your own. I went through, again, 14 months in which we went over a lot of different topics such as grief and loss, teen pregnancy, obviously pre and postpartum care, and how to provide such as a doula while staying within scope. So what an interdisciplinary doula is, it's something that's been coined by the company that trained me, is essentially someone who can do multiple things as a doula. Again, prenatal, postpartum, grief and loss. I actually have done death doulaing by accident. I took care of both my grandmother's, great-grandmother, through hospice care. So before I was even an actual doula, I was, being a death doula. So again, it just covers a wide range, a variety of what a doula can do, essentially. When I had my first son, I was 21 years old, and I was obviously very young. And I wasn't nearly aware of all of the things that can kind of happen when you are Black and giving birth. I didn't even fathom to think about all the things that could kind of go wrong as a Black woman in that environment. And one of the things that I experienced was my son was extremely jaundiced. The pediatric NICU nurses, by the time we had gotten there, they didn't explain things very well. I ended up having to do a lot of research on my own, which was helpful, obviously, because then I could advocate for myself. But even then, I felt more dictated to than being a part of his collaborative care and making sure that we're working together to kind of work towards something that would obviously help his health, but also, again, not just be something where someone's telling me what we're going to do. And I didn't know how to navigate that. I'm lucky to have my mom, who's an RN, who also happened to work on the labor and delivery floor, not at the time, but, she was familiar, again, with that environment. And she was able to teach me and tell me exactly how to advocate for myself, and kind of, I'm gonna say, very Black mom style, one day told me, like, girl, that is your baby. You better take that baby up, because they were telling me that I couldn't directly breastfeed him, my son, and that I couldn't really do any skin to skin time with him because he was so jaundiced that having him not be in his little incubator under his phototherapy lights would literally be fatal for him. It was starting to affect my mental health. I wasn't, again, able to bond with my newborn child, and breastfeeding was always something that I knew I wanted to do because my mom, even though she was a teen mom, breastfed me until I was 3 years old. So I heard stories growing up of all of my breastfeeding antics, which are numerous, and it made it something that was familiar and dear to me. So again, I knew I wanted to do it, and I was being denied that. I was literally being told that I could not do that. So after learning how to advocate for myself, after having to fight for my right to breastfeed my child, to hold my child even, I had come to find out that, I can't be the only one who's going through a scenario like this where you just don't even know what to do, where to go, who to speak to, how to say it, all of the things. And I knew that I wanted to be someone who could help other, especially Black women, navigate this process.
Mom mortality rates in Black and brown women are 3 times as much. And it was really shocking to me to hear the number. And
yes,
did that factor into something that you really wanted to get into different communities to be a doula?
For sure.
Yeah.
These numbers, and I kind of want to put it in a little bit more perspective, because when you say 3 times more likely to die, 3 is relatively a small number. That translates to 243% more likely to die than white counterparts. And we indeed have a problem. It's directly linked to systemic racism and the social determinants of health that racism affects. So we got a problem, and we definitely need to address it. Something that, again, doulas are actually able to help to reduce the mortality rates within, especially urban communities. Even again, before I started on my journey as a doula, I knew the power of breast milk. I had seen it with my mom and myself. It sounds like I'm bragging, but I'm extremely intelligent, right? That is also something that's linked to breastfeeding. I was breastfed for 3 whole years. That's a long time. It's a good amount of time, but most people consider that a really long time. So again, understanding that, I knew that lactation was important. It wasn't until I really started on my doula journey, though, that I really wanted to take it serious and really have a full understanding of the science behind lactation. And that was because as I was learning about everything that goes on with the body as a doula, I was learning that the health disparities that face my community, such as breast cancer, diabetes, insulin resistance, all the things, these are things that actually are reduced, risks that are reduced when you breastfeed for a year or more. So I'm like, if we have these health issues on one end of the spectrum and we can do something as simple as breastfeeding to help eliminate those things, we need to figure out how we need to help people do this, because at the time, breastfeeding initiation rates, meaning like actually starting ever breastfeeding, were egregiously low in my community. So it took me seeing that, wanting to look in a little bit deeper and just kind of figuring out what's going on. The way breast milk works, it's not just food, right? We like to, think of it in that way, of course, because that's what we feed our babies, but it's alive. It changes compositionally, based on the time that you feed. At nighttime, there's actually more fat in your breast milk than compared to during the day. It changes based on the sex of your baby. I just recently read a study that's been conducted, and if I'm not mistaken, they said moms who have boys have higher fat contents in their milk. So it's extremely individualized. Like if your baby is sick, when you latch your baby to your breast, that baby's saliva is going to actually send a signal to your body that says we need antibodies to fight this virus or sickness. And your body is going to respond, make the antibodies and put it into the milk. So it is, again, it's not just food, it's completely alive. It changes per day, per time of day, per everything. It's complete nutrition, and it will vary.
It's fascinating. I didn't know that it would change by the sex of the baby. That's really, that's fascinating.
That's not necessarily common known information.
Yeah,
but yes.
Thank you for that inside information. Monica, I know that you've been really into nutrition as well. Tell me about that aspect of your job.
So the work that I do is focused on making sure the environment is conducive. So as Taylor's trying to support people who are pregnant and breastfeeding to feed their baby well, to think about like, what is it that I'm consuming? My work is trying to make sure that what they have available to them to consume is healthy and affordable. And understanding like that education that Taylor's able to provide. If you don't consume it yourself, your body's still going to give it, and then you'll be depleted. So as a parent, you're going to have less available in terms of your own health. And so trying to ensure that work sites and childcare providers have also healthy options available. Are they participating in the child and adult care food program to allow to ensure that high quality foods are available on a regular basis to the kids who are in care, to know that if you feed an infant breast milk as part of their participation in your program, you can get reimbursed for that meal. It's not, it's so there's all kinds of ways that as a society, we've put these things in place, but they haven't been as readily accessible to everyone. So until the Pump Act was passed, the Connecticut laws were trying to cover employees who weren't covered by the Fair Labor Standards Act. But there were some issues. So if you weren't legally entitled to a break, you wouldn't necessarily get a break to pump milk or feed your baby, even though the Connecticut law covers all employers.
Yeah, it's very interesting. Do employers have to provide a private place for workers who need to pump breast milk? Because I find that it would be really offensive to have to go into the bathroom and do that. There should be a place for it.
Yeah. So it's illegal to require anybody to pump or feed their baby in the bathroom, just like you wouldn't require them to eat their lunch in the bathroom. Breast milk is food.
Right. That's a good point.
Yeah. So it's the same. If you wouldn't eat there, then you wouldn't have a baby eat there. So there's anti-discrimination laws that protect a person's right to breastfeed in public places. So any place that a person is legally allowed to be, they are legally allowed to feed their infant. And you can't ask them to cover up, and you can't ask them to go somewhere else. So folks should know that that's a law that's been in effect for a very long time in Connecticut. And the space that's required for pumping or feeding your baby at work, it doesn't have to be a room that's only used for pumping or feeding, breastfeeding, but it has to be a space that's private. So you can't force people to use it, but it has to be available. And so some employers don't have a room that they can.
I was going to say that, like a small business, what are they required by law? Because some people only have like 3 employees. And
So in Connecticut, if you have one employee, you're required to provide time and space. So, everybody's covered. The space doesn't have to be only for breastfeeding. As I said, it can be multi-use space. Just talk to your employees about what's comfortable for them. I have seen people who are comfortable pumping in a conference room with just a cover. And I've seen people who, because of the way their bodies are reacting, they need a private space where they can close the door and lock it. And they need a sound machine so that people aren't hearing them.
Yeah.
So it really varies by the person.
Interesting.
What their body can handle. Mm-hmm. And so we want to be as flexible as possible. What works for one employee may not work for another employee. And just having that conversation ahead of time with your team, what's going to work for you.
And does the break time that you use for pumping, is that paid break time?
So if it's a normal paid break, then it's a normal paid break. If you need time beyond your paid breaks, then it can be unpaid. And most employers, we encourage them to have a policy that sort of outlines, use your paid breaks. If you need unpaid breaks, here's how to handle it. So you might have to make up the time later. You might have to use vacation time or sick time, depending on what the employee wants to do. But that can be more unique to the employer and what they can afford. But with the passage of the Pump Act, it used to be that in Connecticut, if you were entitled to a break, then you were entitled to use that break for pumping. And now all employers are required to provide breaks, but not all employees are covered. There's some groups of employees that are not covered. But even within, so for example, in the airline industry, pilots and flight attendants are not covered.
Oh, that's interesting.
But everybody else who works for the airline is covered. So if you're in TSA or if you're in working in the airport area, do something else for the airline, then you're covered. So the employer is required to provide the breaks. And so in Connecticut, then you're now entitled to have the break. And I think I'm not an attorney. I don't work for the Department of Labor, so I'm not giving specific advice to employers. But we can help you work through that process.
And DOL would be the people.
And there are staff attorneys at Department of Labor and Commission on Human Rights and Opportunities who are experts.
Yeah, we love CHRO.
Experts. And they have done so much work. I mean, they have been integral partners in lactation accommodation in Connecticut. So huge shout out to Department of Labor and Commission on Human Rights and Opportunities. Really great to work with those folks.
When someone is having real difficulty with kids latching on or it just hurts them so much, what are your suggestions, Taylor?
So I guess I want to make sure I say this right, because this is one of those topics where you really have to consider how someone feels, regardless of what's happening, right? What is that person experiencing? And I'll say most times when someone's having an issue with breastfeeding, in terms of like feeling like they aren't making enough milk, it's not an actual thing that's going on in their body. It's a perceived thing, but each is equally important. So I think as a doula, if I'm having a mom who is experiencing issues with supply, the first thing I'm going to do is take a look at how are they removing their milk. I'm going to validate how they feel and let them know, like, yes, you're struggling. This is why you sought help, and I can indeed help you with these things. And we're going to try everything that we can. Typically the only thing that, I don't want to use absolute there, but more times than not, people who experience actual versus perceived low milk supply are people who have medical contraindications, meaning they literally have something that is preventing their body from doing the hormonal process that it's supposed to do, such as breast surgery or breast cancer or hormonal disorders. And even with those contraindications, it's not necessarily to say that you cannot successfully breastfeed. So it's very, very case by case. So that's, again, low milk supply. If someone's having issues with latch, the good thing about that is that's nothing typically other than a change of position or, something simple. Understanding how to place your hand, something as simple as a finger literally can change how a baby's head is, and then the position of the mouth and the position of the tongue, which can cause pain and things of that nature. So I always encourage women, don't just think, oh, my body isn't going to do what it was supposed to do. You trusted your body to carry out the hormonal process of getting pregnant, of labor and delivery. All those are hormonal processes. If your body didn't fail you then, most likely it won't fail you for lactation. So continue to trust your body. And if you need help, find help. There are people again, I'm a part of a whole mentorship program. I want to shout out Danielle Freeman in Diversity and Paving the Way in lactation, because she's making it so that there are more people who look like us, and therefore it'll be easier to find someone who you feel comfortable to kind of relate to in that way and get help. But regardless of the disparities within, again, the BIPOC community within lactation, I think Black women are 1% of the lactation community in terms of credentials. So that's craziness. But regardless, seek help, because it's there. There are people who can help you through these things. And more often than not, it's a perception thing rather than an actual problem. And slight, tiny changes can really make a difference and help you reach your breastfeeding goals, and so that you can be successful. And your goal doesn't have to be that you breastfeed for a year or 3 years. Whatever your goal is, there is someone there who can help you meet it. And it's so important. It really changes the health outcomes, not only for your baby, but we don't talk enough about how breastfeeding is good for mothers. Again, it lowers the risk for postpartum depression when you're breastfeeding well. And if you're not doing well, seek help, because someone can help you. But ovarian cancer, breast cancer, diabetes, there's a study that recently came out that shows that memory function is improved if you can breastfeed as well. So many things that you can really help within your own body, not let alone your baby, just by breastfeeding. So I encourage women, again, seek help if you need it. Don't just think that you can't, because that's most likely not true. And if you are one of those people who do have a medical contraindication, you can probably still provide your baby some breast milk. And it's so important. Even drops can change outcomes, health outcomes. So don't be afraid to reach out and find a lactation consultant, a counselor, someone who is well-versed in understanding how infant feeding, so that way you can make decisions, informed decisions, I should say.
It's interesting. Connecticut paid leave gives up to 12 weeks of income replacement, so both parents can bond with their child. They also do services if someone needs mental health care. They can also get up to 12 weeks of income replacement, which is really important when you're struggling like that. How significant is this program to aid in what you both do for parents and the family? I'll leave it open to both of you, Monica and Taylor.
I'll go first. So what we're hoping to see is that families will be able to take advantage of paid leave to get the rest that they need, to have time together, to allow for their family, extended family, to provide support, to allow time for Taylor, other doulas, lactation providers to be there with them. The thing that I worry about is do folks know that they have access to the paid leave?
That's why we do these podcasts.
Yeah,
to get the word out to people, because it is a new program. So we're trying to get the word out to people to let them know, hey, this is available. And if money is an issue and you can't stay home with your child you can only stay home for 2 weeks, there is something that can help you.
And that was the thing that we were seeing a lot in working with folks in the community. One of the reasons that families might decide not to breastfeed is because they were going back to work so early. So they didn't want to start breastfeeding and then have to switch because their employer wasn't providing them with time for pumping, or they didn't feel like they could ask for it. We still see a lot of people giving up on breastfeeding, and that is, so they give up. They don't choose. They feel like they have no choice, and so they give up on it. And that level of disappointment and frustration and loss, I think, goes unrecognized as part of the whole decision-making process. So when you look at hospital data, families are choosing to breastfeed. 80% of Connecticut families choose to start breastfeeding. They want to give some breast milk to their baby. And then you see these time points where they drop off, and it's 2 weeks, it's a month. Those were the time points when people were going back to work. So having employers on board, providing clear, useful, and supportive information prior to going out on leave to have your baby, providing the support to both parents. There might be a same-sex couple where both parents are trying to breastfeed, so we want to make sure that both parents have access to that kind of
both parents
accommodations.
It doesn't matter what the family looks like. So if both parents have access to it, how important do you think it is for parents to know this and to take time?
So I'll let Taylor speak to her experience, but I think it is critical. It's essential. We don't allow ourselves to rest. That's a common across women, but I think women of color especially. As Taylor said, like there's the image of the strong Black woman, and we don't offer that opportunity for rest and recovery. We all need to rest and recover when we have a baby. I mean, both parents need to rest and recover when you have a baby in the house. It's exhausting work. And we don't categorize caring, the whole caring and, things that people do to care for their family. We don't recognize that as work. So I'll let you jump in, Taylor, I'm sure.
I wholeheartedly agree with everything Monica just said. It is imperative to ensure that people aren't forced back into the workforce before even 12 weeks, let's be honest, that's still, for a lot of people, too soon. But it is much better than 2 weeks.
What is the Connecticut Breastfeeding Coalition? I really want to know a little bit about that. And what do you do as a co-chair? Because you've both been co-chair, so you can probably both answer this question.
So I will say, as of June, I have stepped into the role of co-chair alongside my other co-chair, Erin. We stepped into this role, and we've been kind of meeting just to, I'll say, rebrand, essentially. We want to give the CBC, the Connecticut Breastfeeding Coalition, a fresh face. And what we strive to be, I will say, is a group of people who are action-driven and want to improve outcomes throughout the breastfeeding outcomes, throughout the state. We want to obviously protect, promote, and support breastfeeding, recognition programs, free educational opportunities to help maintain certifications for people, obviously work alongside Zip Milk, and we are still in the process of supporting the Paving the Way initiative and mentorship program to ensure that, again, Black and brown bodies have access and guidance towards obtaining their lactation credentials.
I mean, it's hard to capture everything I think that the coalition does, especially, a couple months into being co-chair, but you did a great job. And I'll just say, if folks are interested in participating in any of our work, the website has a lot of information. And we have a Facebook and an Instagram, so folks can just check us out.
With the support of the CBC, there have been several programs, including Paving the Way, that have come out to support Black women in the community. And when you support the community, even if it's not directly like helping someone latch a baby, you are uplifting that community. And as someone who has been impacted by that, when you pour in, you give something to pour out, if that makes sense. So alongside that, with having myself as a Black woman serving as a chair, Danielle Freeman was actually the previous co-chair as well. That alone, when you have people who look like you serving as in the leadership roles, you just have the leadership is going to have a better understanding of the needs of the community. So just by having me here as the co-chair alone is going to help the community, because I know what to suggest for things that are impacting my communities. I know the issues and the things that my community faces, and kind of have an understanding of how to tackle those things. It's just, I need some support. I need some, ways to access monies and things of that nature. And that's, again, the goal of the coalition. We want to be able to just pull from all resources, whether it be people, again, whether it be monies, grants, whatever it is, to be able to tackle the things that we know. And again, having people of color, BIPOC women, especially in leadership roles, is going to help enhance marginalized communities because we know what we go through.
Well, I'm in awe of everything she's done. And our state is really lucky to have her both as the co-chair of the coalition, but also as this provider in the community, providing doula support, providing lactation support. It's amazing. And I think we miss out when we are not supporting folks in the community in this way.
I want to thank my incredible guests, Monica Belia and Taylor Smith, for joining me on the podcast.
Thank you so much for having us.
Yeah, thanks, Nancy. This was great.
Yeah, well, you guys were great, and thank you for all the information. And for more information or to apply for benefits, go to ctpaidleave.org. This has been another edition of the Paid Leave Podcast. Please like and subscribe so you'll be notified about new podcasts that become available. Connecticut Paid Leave is a public act with a personal purpose. I'm Nancy Barrow, and thanks for listening.